is Dr. Epstein. I'm here with a very important visual aid to show the difference in the advantages and relative advantages and disadvantages of strip versus FUE. This is a perfect case, and the patient's nice enough to let me film the back of his head. This is a patient who had originally 3 years ago had work, FUE grafts, around 1,000 grafts, by a very reputable FUE surgeon who did, as I said, around 1,000 grafts taken from the back of his head, was happy with the results but felt he didn't get enough growth, so came to me and I discussed the options of doing more FUE work versus doing a strip. The big debate, of course, amongst FUE surgeons is they say that the strip caused by, removing the scar caused by a strip is much worse than the scarring caused by FUE, which is essentially a scarless technique. And while I do advocate doing FUE work, I think it's got a great indication, especially for guys who want to shave their head. I think for many patients, especially over the age of like mid-30s, strip makes a lot more sense because you get a higher rate of growth. Well, the bottom line is the patient's back today, 3 years after he had, a little over 3 years after he had more than around 2,200 grafts, very happy with the density, significantly better results than what he felt, or moderately better results than what he felt he achieved with the FUE. But anyway, he's here, and I want to just show, if you can appreciate, the difference between the scarring from a strip, which is healed up very nicely. Let me show you right like this. You can see here, here's his donor site scar right here. It's a linear scar. You can see it, I'm coming around, so it really healed up beautifully. Versus, and I don't know if you can fully appreciate it, the diffuse thinning that has taken place as a result of the FUE grafts, which were done properly and it looks good, but it's definitely got a thinner look. Now, no one would say, "Oh my goodness, that's a donor site scar," because it's not a quote linear donor site scar. But here's a strip versus here's all these FUE punch graft holes, which have healed up nicely, but they are visible as well. So once again, this is not necessarily proof that strip is better than FUE, because they're not. It just means what this video shows is that there are advantages and disadvantages. For this patient, he clearly is quote sold on strip, and if we do any more work, I believe he's going to choose to have more strip work done, using the old scar once again, and so not even needing to extend that original donor site scar. Anyway, this is Dr. Epstein talking about the difference between strip versus FUE. Thank you.